Joined now by Thabo Masebe, Head of Communication at the Gauteng Provincial Government. A very good evening to you, and thank you so much for joining us, Mr. Masebe. Earlier on, we saw Premier David Makhura say the provincial government is looking at what regulations need to be looked at again, speaking about going back to more stringent rules. Which regulations are being considered?
Well, first of all, let me say, Tsepiso, yes, the Premier did say that the Gauteng Provincial Government is concerned about the increasing numbers of infections in the province, resulting with many people requiring hospital treatment. So many people are now being admitted to hospital, having tested positive for COVID-19. So all of this, we said, we can see the numbers started increasing exponentially since the beginning of level 3 lockdown. So as we eased the regulations, more people going back to work, and now we also see the schools having opened. All of these have resulted in an increased number of infections exponentially. So we're saying we need to look at the measures and ask if there are any things that we could do to tighten the measures so that we could help to reduce the numbers of new infections.
So what are we looking at practically? Reduced movement, shutting down of some of the industries that were open or sectors?
No, Tsepiso, we're not looking at shutting down industries. At the start of level 3, or shortly even before we moved to level 3, the Gauteng Provincial Government did say we understand that we have to start reopening the economy, but we also said we understand the risks that will come with more people or with the relaxation of lockdown measures. But these are risks that we then need to find measures to mitigate those risks. So we do accept that measures have been relaxed. More people are now back at work. The schools have reopened. But we then say, as government, we've got to look at other things that we can do to try and reduce the number of infections or to limit the spread of COVID-19 in the province. So exactly what are those measures? These are issues that the Executive Council will be discussing over the weekend. They have a meeting on Saturday. They will look at all factors that have led to the increased
okay, Mr. Masebe, allow me to interrupt you. The Premier himself has at some point spoken about going back to level 5 restrictions. There has been There has been suggestions of intermittent lockdown. What are we looking at practically here?
So the Premier did not speak about any level. He said, let's understand the risk and see what measures we can take to mitigate the risk. So we are concerned, of course, about the increasing number of infections. And if we can do anything to look at the number, the movement, the number of gatherings that we are now seeing, we need to look at all of those things. He also mentioned the impact that alcohol has on the infections and on our hospital services. So we're going to look at all of those things and then go to the National Command Council and make suggestions of what could be done to strengthen measures to try and limit the spread or stop the spread of COVID-19.
Okay, so just looking at the fact that we have the highest number of active cases in Gauteng, and cumulatively we have about 4,455 patients that have been admitted to hospital. Over 1,000 of those have been discharged, but we've also seen that quite a significant number are on ventilators and some are receiving oxygen. So what would you do to protect them? So some of the issues that have been discussed, as you mentioned, the sale of alcohol, the return of school students, the reopening of churches and specific sectors. So if you say you want to reduce the high number or the levels of vulnerability and high levels of exposure, what would you do then practically with these issues or sectors, restrictions that I've just mentioned?
Yeah, I'm not able to get into the specific issues now because these are matters that are going to be discussed at the Executive Council over the weekend on Saturday. They will look at all of these factors. They will look at the number of unnecessary gatherings that we are seeing, the marches that we see all over the province, the people who are in the streets, even those that are not going to work, but we see them all over in the streets, in the townships, in the city centers, and so on. And then we'll have to look at how people behave in places like funerals and say, are there any other measures that we can put in place? As we mentioned earlier, the sale of alcohol or consumption of alcohol, is there anything that we can do further to try and encourage people or force people to use alcohol more responsibly? So we'll look at all of those things.
Okay, before we run out of time, Mr. Masebe,
to the national government.
Before we run out of time, let me ask this. The original model showed that there was a gap in the number of beds needed. There is now a remodeling. What are you looking at? What's different now? What have you learned on the vulnerability of the public health care system, especially seeing the Gauteng Health MEC has said that the system is feeling the pressure. Some have even said it's near collapse.
No, it's definitely not near collapse, but it is feeling the pressure, especially because some of the health workers are themselves getting infected. So what we are doing, there are two things. One, we are increasing the number of beds in the hospitals, including field hospitals that are going to be built in the next, within the month of July. With all the plans that we have, we are confident that we will be able to care for all the people who need hospital care. And at the same time, we are employing more people, more health workers, doctors, nurses, and other health professionals to make sure that we have enough personnel to care for the people who need hospital care.
Thank you so much for speaking to us, Thabo Masebe, Head of Communication at the Gauteng Provincial Government. A reminder that we are asking you as our question of the day.